Hi, let's begin now. Let's start with a prayer muna po.
There are times when you might feel aimless. You can't see the places where you belong.
But you will find that there is a purpose. It's been there within you all along.
And when you're near it, you can almost hear it.
It's like a symphony. Just keep listening, and pretty soon you'll start to figure out your part. Everyone plays a piece, and there are melodies. Each one of us. Oh, it's glorious.
You will know how to let it ring out as you discover who you are.
Others around you start to wake up to the sounds that are in their hearts.
It's so amazing what we're all creating.
It's like a symphony. Just keep listening, and pretty soon you'll start to figure out your part. Everyone plays a piece, and there are melodies. Each one of us. Oh, it's glorious. Glorious, glorious, glorious.
That you feel the notes build higher. You will see.
It's like a symphony. Just keep listening, and pretty soon you'll start to figure out your part.
Everyone plays a piece, and there are melodies. Each one of us. Oh, it's glorious.
Hi, good afternoon, everyone. Let's begin na po with our first aid. So basically, guys, pag sinabi po nating first aid, ang hango po yung first aid natin na discussions, it's based po no, sa American Safety and Health Institute, which is ASHI. And then we have here the American Heart Association po. Kasi both of them, they're offering po mga basic first aid. However, kasi yung mga first aid po natin today, syempre hindi yung mga fractures, like yung mga bandaging, no po. Mga cravat natin, hindi po. How are you going to treat bleeding? How are you going to differentiate? Na is simple allergy or allergic reaction from a more severe one, which is the anaphylactic reaction leading to anaphylactic shock. So yun po yung mga topics po natin this afternoon. Okay? Now, when we talk of first aid, guys, sige nga, sabay-sabay po tayo. Everybody say first aid.
First aid.
Thank you so much. First aid, guys, is the first and immediate assistance given to any person suffering from either a minor or a serious illness or injury. Now, so this is an immediate care to be exact. Sulat natin. So we have the word immediate. It's po. Yun yung pinaka-importante din. Ayan. Sir, ano ba yung importance ng tinatawag na first aid po natin? Ayan. With your first aid kasi, guys, ang pinaka-basic talaga na dapat nating malaman dito is that kung ano yung mga priorities po natin sa tinatawag na first aid. Or bakit siya importante? Number one, this is to preserve life. Aside, okay, from preserving life, we need to alleviate suffering. Ayan, alleviate. Ayan, sufferings po. Let's say baka in pain ang patient natin. Ayan, preventing. Ayan, worsening. Ayan, preventing, okay, worsening, okay, of the, ayan, condition ng patient po natin. And then of course, this is to promote, ayan, recovery. So once again, bakit daw importante ang first aid? This is to preserve life. Next, to alleviate suffering. Next, preventing, okay, the worsening of the said condition. And lastly po, this is to promote, okay, recovery. Sa mga ano lang, let's say sa mga hindi masyado serious, okay, na mga cases. Kasi, if feeling mo na parang, let's say, kailangan mo nang i-refer ang patient, then you need to do that. Simply, you need to dial 911, di ba? Or let's say, kung nasa provinces ka, simply, okay, you dial yung mga tinatawag na mga 117 po natin. Now, as a basic, okay, let's say, first aider kasi, we need to consider, okay, few things then. Like for example, is there, ayan, any danger? No, you need to ask, 'di ba? Pwedeng okay, danger sa iyo or danger sa victim din. However, kasi yung tinutukoy ko dito po is the rescuer, okay, and victim safety kasi. So, is there any danger? Number one, okay, to the rescuer. Ayan, next we have your, okay, meron ba tayong danger din sa victim? Aside, okay, from, okay, the first po, okay, na question, ayan, are others, okay, around to help? Are others, ayan, around, are others, okay, around, okay, to help? So, pag sinabi po natin are others around to help, ayan, mga bystanders po ang tawag sa kanila. Now, next question will be, ayan, how many people, okay, are injured? How many, ayan, people are injured? Kasi kailangan kasi ng backup if ever po kung ikaw lang mag-isa. Ayan, and then, next question is that, how were, okay, they injured? Pwede kasi may tinatawag tayong mga blunt trauma, meron tayong mga obvious po na exits ng blood kasi meron tayong mga external bleeding, meron din tayong mga internal bleeding. Ayan, next question, where is the nearest, ayan, telephone? Sir, bakit kailangan ng nearest telephone? Kasi if ever kung wala kang cellphone, then you simply you dial 911. And then sa pag-dial niyo po ng 911, what is your location? Okay po ba? Kasi yung ibang tao kasi pag sinabing first aid, feeling nila puro fracture lang, 'di ba? Puro bandaging lang po yung alam nila. Na no po. Na syempre you need to consider okay these questions. Now is there okay any danger? Let's say for the rescuer, which is ikaw yon, the basic first aider or first aid provider. Ayan. Sir, meron bang danger din okay, kay victim? Kasi if ever po kung may danger na po kay kay rescuer, do you think, okay, ipo-push through mo ba yon? Siyempre, magdadalawang isip ka. Next po, are others, okay, around to help? Ang tawag natin doon, mga, okay, bystanders po. Or baka mga chismosa lang sila, guys. Baka mga marites lang din at walang maitutulong. 'Di ba? Picture lang. Ngayon kasi, picture muna, document muna before tatawag ng 911 para mag-trending sa Facebook. Tama ba? Ayan, how many people, okay, ayan, are injured po? Siyempre, you need to consider din. Baka ikaw lang mag-isa at madami sila. So, pagkakaguluhan ka nila doon, hindi ka na makafocus tuloy. And the next question will be, how were they injured? No, nahulog ba sila? Pag nahulog kasi, pwedeng mahulog sa diba, sa building, no? Or pwedeng nahulog sa pader, or pwedeng nahulog din sa maling tao. Ayan, next. Now, saan ba ang nearest telephone if ever kung walang cellphone? And then of course, you need to tell them that your exact location. Kung saan ka ba located ngayon para at least magpapa-dispatch po sila ng help. Okay? Ayan, sige po. So let's move further na. Ayan, in saving lives po, we don't require licenses here. As long as you're trained, okay, with the basic first aid, then no of great help ka na po no with others po, especially for those who are in need. Now, my question is, ano ba ang laman ng ating first aid kit? Anyone? Sige nga, pa-chat nga po no, ng mga laman ng ating first aid kit. If ever you're familiar po. Ayan, hintayin ko yung mga chats nyo ha. Ano kaya ang mga laman ng ating first aid kit? Sige, pa-chat na lang po. Hihintayin ko ang mga laman ng first aid kit natin. Or let's say, tatanungin ko na lang na si Ma'am Janice, ayun, may mga gauze pads, may mga bandages, okay, may mga scissors din po tayo. Ano pa? Ano pa? Meron ba tayong mga rice cooker doon? Meron ba tayong mga air fryer? Ay, may mga ice pack. Ayan. Ano pa? Ice pick. Siyempre, walang ice pick. No? Mga antiseptic, mga alcohol. Ano pa? Yung gloves. Yes, importante po yan. No? Basic requirement talaga yan. May mga micropore, may mga splints po. No? Ayan. What do you mean by splint, ma'am? Yung ano po? Sige, malalaman po natin yan, no? Kung the same ba ang mga sagot po natin. What's inside, okay, ayan, first aid kit po is of course we have the bandages, no? Meron din tayong mga skin tapes, meron tayong mga triangular bandages, may mga for eyes din tayo, 'di ba? May mga gauze pads, may mga dressing pads po tayo, mga safety pins, tweezers na meron din tayong mga burn cream, no? In the cases of let's say first aid for burns, which is actually our topic then later. Next, we have syempre may booklet din po tayo, kailangan din. And sa states din po, separate po yung if you're familiar with the EpiPen, the epinephrine pen, in cases like baka lang bigla magkaroon ng anaphylactic reaction ng patient po natin. Okay? Ayan, sige. So do not forget also not to wear your PPEs or your PPEs. PPEs, syempre that's the personal protective equipment. Now, walang S po ang equipments, guys. Ha? It's equipment lang because the plural for equipment is equipment also. So aside from that, if ever kasi in the times of COVID po, ayan, sa times ng COVID, usually, full gear po tayo. Di ba meron kaming 911 dito sa Davao, so naka-full gear talaga sila every time na lalabas po sila. Even now, kahit hindi po nag-surge ang COVID, ayan, lumalabas sila ng ambulance na naka-full gear sila, as in like full PPE. Ayan, sige po. So topics for this afternoon, we have the breathing problems. No, meron tayong mga anaphylactic reaction no, to anaphylactic shock. Meron din tayong mga chest pains and heart attack. Of course, may mga videos tayo. We have the fainting. Guys, what's the medical term for fainting? Anyone? It's the syncope. Great. Now, it will be discussing hypoglycemia in which that can cause irreversible brain damage. Now, sa states kasi, meron tayong mga may mga lifesaver gum po tayo. Ito yung nakikita po natin sa mga malls, let's say sa mga cashier na part area. 'Di ba parang may nakalagay lifesaver gum. It's actually a sweetened gum in cases like syempre lang no, if ever po kung nagkaroon ng hypoglycemia. So ano ba yung mga signs ng hypoglycemia? Mamaya i-discuss po natin 'yan. Of course, we have the stroke. No? Yung stroke kasi na-discuss na po natin yan kaninang umaga eh. Next, we have the seizure. Diba guys, pag nag-seizure po yung patient po natin, may mga S tayo na mga mnemonic din. Na? Kailan ba usually nagsi-seizure po ang tao? Pag walang pera. Tama? Or let's say, pag papunta na po yung Lazada nila at Shopee, tas wala silang pera. Seizure na lang. No? Seizure mode. Next, we have your shock. Na? I-discuss natin yung shock. Usually yung didiscuss, later po ang dinidiscuss ko kasi is the hypovolemic shock, yung excess, 'di ba? Yung we have the excess amounts no ng tinatawag na fluid ang mawawala sa iyo. Yes. Ayan, next we have the bleeding. The bleeding you can see and the bleeding you can't see. Ano yung delikado, guys? The bleeding you can see or the bleeding na you can't see?
You can't.
Anyone from the group? You can't see. Tama? What if nag-bleed pala? No? What if nag-hematoma ka? What if nasa brain mo? 'Di ba? What if okay internally, no? So nakakatakot 'yon. And then we have the electrocution din. Siyempre yung mga electrical wirings po natin na kung saan ito very common to sa mga bata ngayon. 'Di ba pag nakahawak ng mga spoon ng mga ng mga let's say tinidor, tas no ipapasok talaga nila sa mga sa mga outlet. 'Di ba? Kaya grabe. Very common na din 'yan ngayon. So careful po tayo. Now, for our first topic, handa ka na ba? May I see some heart reactions po. Ayan, para galaw-galaw din tayo pag may time. Ayan. Be like Ma'am Mary Joy Copino. Happily in love. Sana all. Sana all may jowa. Na sana all may may kasama sa profile pic. Ako ang kasama ko lang talaga, me, myself, and I. Ayan. Sige po. So let's have, the first topic na po, let's have the breathing problems. Now with your breathing problems kasi guys, you need to identify whether if it's a simple allergic reaction or an anaphylactic reaction na po. Ano ba yung pinaka-worst? Is it an anaphylactic reaction or allergic reaction? Anyone? Anyone from the group? Ano yung mas delikado? Allergic reaction or anaphylactic? Great. Now, it's the anaphylactic reaction. Why? Kasi anaphylactic reaction that can lead to anaphylactic shock. Now, a simple allergic reaction kasi, we have the runny nose. Meron akong patient before, sabi niya, nurse, ba't parang nahihirapan akong huminga? Feeling ko may running nose ako, ha? Tumatakbo ang nose mo, running nose. Sabi ko, runny nose yan, ma'am, hindi yan running nose, na? So we have the runny nose, 'di ba? Kasama kasi ng runny nose mo, we have the itchy, red, and watery eyes. We have the hives, 'di ba? Yung redness po, no, yung pantal-pantal, then we have the itchy rash. Yes, you heard me right. Wala pong word na rashes. It should be rash alone lang po. Na the plural form for rash will be rash lang din. Paano ba 'to mina-manage? Mamaya po meron po tayong videos dito. For the anaphylactic reaction naman guys, as you can see sa screen po natin, na mas worse po ito kasi may mga edema na mangyayari, na may mga narrowing po sa airway na mangyayari kay patient. 'Di ba? Ang sabi dito, allergic reactions can progress into full anaphylaxis. So meaning to say, mas delikado nga na ang tinatawag na anaphylactic reaction compared to a simple allergic reaction. As you can see, sa screen po natin, we have the swelling, 'di ba? Pamamaga ng face, ng lips, ng tongue, ng throat, ng upper airway, meaning to say that leads to edema. Edema talaga ang pinakalaban natin dito. Okay po? So we have here the breathing problems. Now, with your breathing problems kasi, I'd like to emphasize this. Sa States po, nagko-cost po ito ng almost $200. No? Yes, dalawa na yung package. Dalawa na po na yung EpiPen na yan. Kasi right after that, na-dispose agad yan na yun nga lang, mahal nga kasi, almost $200. So almost 10,000. So this is a 0.3 milligram. Mamaya sa video po natin, i-demonstrate po nila kung paano. This is actually IM in between your thighs. Doon po, IM po. Usually nagka-count lang sila ng 10 seconds. And then after 10 seconds, imamassage po nila. And that's for the EpiPen or the epinephrine pen. Let's proceed na sa ating video, guys.
Shubi.
Now let's cover allergic reactions. We've all heard stories of people who have died suddenly from a severe allergic reaction, and these stories are frightening. But fortunately, events like this are very rare, with less than 1,500 deaths from all different age groups and all types of allergies in the United States. Statistically, this is a very small number compared to approximately 50 million Americans that suffer from some form of allergy. But unfortunately, recent studies show that allergies of all kinds are increasing in developed countries. Nobody knows why for sure, but one prominent theory is that we've developed too sterile a lifestyle. With the constant use of antibacterial soap and this different hand sanitizers and airtight modern homes, our body's immune systems are not developing to fight germs in the same way as they did in the past. Now, this can lead to overreactive immune systems. Finding a balance between healthy living and clean living is a must. So other theories include overuse of antibiotics, excessive immunizations, highly processed foods, and environmental pollutants that have all led to the breakdown and confusion of the body's natural immune system. But whatever the cause, the reality is that more people are developing allergies than ever before, and we need to be prepared to handle those emergencies from allergic reactions. Now, you might find it interesting to know that food and insect allergies are the most common causes of severe reactions that happen outside of the hospital, with food allergies being the most prevalent. Children tend to be the most affected, and according to the Centers for Disease Control and Prevention, between the years of 1997 and 2007, in the United States, the number of children that have food allergies rose by 18%. Fortunately, most children outgrow their food-related allergies by adulthood, but peanut allergies, they tend to be lifelong. Now, you might be thinking to yourself, yeah, but what causes an allergy to develop? Well, the immune system normally defends the body against things that can be dangerous to your health, such as viruses and bacteria. A healthy immune system keeps a person from getting sick when harmful germs find their way into the body by attacking and destroying the germs. An allergy results when the immune system mistakenly targets and overreacts by attacking a normally harmless substance that's been eaten, inhaled, injected, or has contacted the skin. This substance that causes an allergy is called an allergen. An allergen may have been introduced to the body many times before without any trouble at all. But at some point, for some reason, the body flags it as an invader and triggers the immune system to attack the allergen. The body will remember that specific allergen by producing antibodies that will be ready to go into action to attack the allergen as soon as it enters the body. This is the reason that an allergic reaction is often more severe the second or even the third time when it happens. Now, when the immune system attacks an allergen, high quantities of histamine and other chemicals are released into surrounding tissues. And depending on the part of the body involved, the histamine and chemicals cause itching, hives, rash, sneezing, it can form wheezing, it can make swelling, a runny nose, nausea, and even more symptoms than that. Now, a serious allergic reaction that can be life-threatening is called anaphylaxis. This is a severe, sudden reaction that affects many parts of the body all at the same time. And it typically begins within minutes after an allergen is introduced to the body. This severe allergic reaction can cause the body's vessels all over the body to dilate. In other words, they open all the way up and cause anaphylactic shock. The full opening of the blood vessels causes a sudden drop in the blood pressure, and the brain and the other vital organs become oxygen starved. Anaphylactic shock will cause death if it's not treated. Now, the treatment is epinephrine, which helps constrict the blood vessels and open the airways. Now, the most common things that cause anaphylaxis are foods such as peanuts, tree nuts, fish, shellfish, eggs, and milk. Biting or stinging insects such as bees, latex, and medications. Now, food is generally the most common cause of anaphylaxis, with peanuts being the most common cause of fast, severe, and life-threatening reactions. Because severe nut allergies tend to affect children, a lot of fear is associated with nut allergies. It has become a very popular and emotional topic. This is the reason that many schools, airlines, food manufacturers, and other places have become nut-free zones. But more effective than banning nuts completely, there are precautions public facilities can and should practice, such as having nut-free tables at lunch for children to eat. Most importantly, children need to be taught what foods to avoid. Children with allergies need to carry an EpiPen. Schools, daycares, camps, and other places that typically serve food to children should have EpiPens for emergencies. Now, preventing an emergency is the best, but if an emergency happens, you need to know how to recognize it and be prepared to handle it. The following signs and symptoms would indicate a person is going into anaphylactic shock: trouble breathing, wheezing, tightness of the throat, an itchiness on the tongue, swelling of the face, eyes, lips, hives, itching, flushed, or pale skin, rapid heartbeat, low blood pressure. Maybe they have nausea, vomiting, or diarrhea, dizziness, fainting, or eventually unconsciousness. Now, children may describe their symptoms in the following way. They may say things like, it feels like something's poking my tongue, or my tongue is tingling, my mouth itches, my tongue feels like there's hair on it, my mouth feels funny, there's something stuck in my throat. They might say things like, my lips feel tight, or my body feels weird all over. And if you recognize any of the signs and symptoms of anaphylaxis, don't wait for signs and symptoms to get worse. Call 911 immediately. And if it's available, assist with or administer an auto-injectable epinephrine, such as an EpiPen. Keep the person calm. Have them sit down and be in a position of comfort while you're waiting for the ambulance. Let them sit in a position that's easiest for them to breathe. Typically, this is sitting up and leaning forward. And if the person feels faint or is not fully conscious, lie them down, elevate their legs, and keep the person warm. Talk to them, reassure them, and keep the person's airway open while monitoring their breathing, and be prepared to start CPR if the person stops breathing and becomes unresponsive. It is possible for a reaction to happen again after the initial reaction. So most people should be really cautious and be observed during the following 4 to 6 hours after they had their first initial event. Remember, the best way to help somebody in an anaphylactic reaction is to recognize their signs and symptoms early, activate EMS, calling 911 or a code, and then assisting them with their EpiPen to reverse their symptoms and help save their life.
Can I have a piece? Try it. It's really good. Hey, Anthony, can you help?
In all my years as a licensed paramedic working on the street, not many acute illnesses are as scary as a severe allergic reaction. We have a fancy word to call that. It's called anaphylaxis, which is the body's reaction to something that is causing them to have a number of different symptoms that could lead to a life-threatening emergency. In this scenario, we're going to teach you what anaphylaxis is, what it's doing in the body, and then how we may be able to treat them until emergency medical services arrive. So what is anaphylaxis? Anaphylaxis is an allergic reaction where the body does a couple different things at the same exact time. While the blood vessels are dilating and becoming leaky, allowing fluid to leak out into the tissues of the body, decreasing the blood pressure, so is working together to create hives, the scratchy, the itchy throat, the swollen tongue, the swollen lips. Those are all kind of superficial as far as the outside of the body, but what is happening inside is what we hear most of the time, and that's difficulty breathing, wheezing, looking pale, we're going to be aware of as we're dealing with this anaphylactic patient. Now in this scenario though, she was wise. She understands that she's having a problem, and she told somebody who was a bystander to go get help in for these types of emergencies. But in this case, didn't know she had a food allergy. So her brother shared the candy bar with her. It might have had an allergen in it. Obviously it did. And now she's reacting to it. So as soon as we could, we got to her EpiPen. A few points to think about here is we need to make sure that the date is still within the expiration range so that it's good. we're going to pull the cap off, the safety cap, and it's important to remember that we grip it firmly in our hand, but we do not put a thumb over the needle area or over the back of the EpiPen. Now that this has been readied, I'm going to hand it to this victim who's now going to auto-inject. She puts it into her big muscle in her thigh and holds it there for 3 seconds. She now takes it out of her leg and lays it beside her. While she does that, she massages the leg and tries to get the medicine to absorb into that deep intermuscular injection. This training is based on the EpiPen brand, so if you use a different brand, make sure you follow that manufacturer's directions. Now, while we're letting that get into the system, if we have not already called 911, we should be. So if you have a phone, dial 911 and get emergency medical services on the way. If you don't have a phone, send somebody to go call 911 immediately. If there's a delay in emergency medical services of greater than 5 to 10 minutes and the patient actually has a second auto-injector available, we can actually deliver a second auto-injector if the signs and symptoms of her anaphylaxis have not improved. Now, we're always going to be monitoring this patient for an increased problem, maybe a loss of consciousness, increased difficulty of breathing, or respiratory arrest, and then eventually cardiac arrest. And we're going to treat them accordingly.
Okay guys, so basically kaya po tinitreat yung tinatawag na anaphylactic reaction, ayan, with your epinephrine because the epinephrine will serve as a bronchodilator. Hindi na kasi effective yung mga simple mga anti-allergens po natin. No, in cases like, let's say severe cases like leading to anaphylactic shock before, magkaka-shock si patient, dapat i-prevent po natin yan, and that's where the EpiPen. Pag sa States, EpiPen po ang tawag nila doon, or the epinephrine na mga auto-injector po nila. Now, let's proceed sa ating next topic. So ganun po yung flow natin ha, slides and then video po agad. So we have the next topic known as the choking. Now, this is the universal sign of choking. Sige nga, please turn on your videos muna. Lahat po tayo, i-follow po natin na yung universal sign. Sige nga, para ma-identify po natin. Depende kasi kung na-choke ka talaga sa food or na-choke ka lang talaga sa jowa mo na masyadong possessive. Natawa bigla si Ma'am Mary Joy. Oh. or baka nasasakal na tayo guys na sa mga jowa nating possessive masyado. Lahat na lang, 'di ba? And so that's the universal sign of choking. So if ever po, no, kung sawang-sawa ka na sa jowa mo, harapin mo siya, tapos gaganon ka bigla, oh. Alam mo ba to? This is the universal sign of choking. Sakal na ako sa iyo. So ayun po, with choking kasi guys, no, if ever kung kaya pa, 'di ba? May mga maneuvers po tayo known as the Heimlich maneuver. Napakita ko na ba yung video kahapon sa choking? Tama ba ako? Yes, ang alam ko tapos na tayo sa choking kahapon na yung video po natin. Yes, so again, that's the universal sign of choking. Now with choking guys, na kung kaya pang i-Heimlich maneuver, pero if ever na po kung let's say ang patient mo biglang naging unconscious na siya, so that's the time, no? Tapos no pulse, no breathing na din, doon na papasok yung BLS po natin or the basic life support. Simply having the high quality chest compression. Eto guys, this is the Levine sign. If this is the Levine sign, this is the universal sign of what? Chest pain. Now with chest pain kasi, we need to identify whether if it's angina pectoris, ayan, angina pectoris, or baka nag-MI na ang patient mo, 'di ba? Pag MI kasi, this is the severe form. And pag MI po, again guys, this is already irreversible in nature. How will I know pag angina pectoris? If that will last for about less than 15 minutes po, then that is an angina pectoris. If the pain, lasts, for about 15 minutes, tapos greater than 15 minutes unrelieved, by rest, unrelieved, by nitrates, that's already an MI. Now, sir, pag angina pectoris, sa pain kasi nila, ito kasi it's stabbing pain . 'di ba? Stabbing pain. Pero pag okay, MI na po, this is the excruciating one. So we have excruciating, okay, pain. Sir, ano ba ang let's say, paano ba i-describe ang excruciating pain? Pag pinipiga na po yung chest mo, it's already an MI or myocardial infarction. Pero pag parang sinasaksak pa siya, tapos pwedeng ma-relieve na by rest, ma-relieve din siya by nitrates, ang tawag doon angina pectoris, or simply that's your chest pain. So ulitin ko lang, angina pectoris can be relieved by, let's say, rest. It can be relieved by nitrates also. Pero pag MI na po, for greater than 15 minutes guys, tapos nagbigay ka na ng mga nitrates natin, tapos unrelieved pa rin siya, tapos unrelieved pa rin by rest, then it's already your MI. And that's your excruciating pain or pinipiga. Now, with your chest pain, if that is an angina pectoris, the same pa rin, may Levine sign pa rin sila. So we have the substernal chest pain, secondary to myocardial ischemia. Meron kasi tayong mga, di ba may mga types kasi tayo ng angina pectoris eh. Although hindi na natin sila i-discuss, basta careful pa rin tayo sa mga bisyo po natin like smoking, tapos napakaraming let's say fat na in the diet. So we have the hypertension, then we have the obesity. Kasi from angina pectoris, baka if left untreated, pwede po siyang mag-lead to myocardial infarction. Next, guys, aside from having your angina pectoris, we have the severe one. This is actually your, pinaka-irreversible na po. Pag sinabi po natin irreversible, hindi na po siya treatable. If ever kasi kung nag-MI ka, pwedeng mag-reoccur din yan sooner or later. May history ka na eh. 'Di ba? May damage na kasi ang heart mo. From myocardial ischemia leading to myocardial injury na leading to myocardial infarction. So ano ba yung mga symptoms po natin? Parang feeling mo mahihilo ka, there will be nausea also, there will be cold sweat, there will be dyspnea, and then the pain guys, chest pain mo, it's basically excruciating, pinipiga talaga ang pain na to. Although the same naman sila with angina, nagra-radiate din sila sa jaw, sa neck, at the back of the patient, pwedeng left shoulder. Bakit kaya puro left? Kasi with its close proximity kasi sa heart eh. 'Di ba nasa left side kasi din yung heart natin. Kaya left shoulder, left arm tapos sa back, commonly on the left side din. Sige. So let's have the video presentation. Ayan, ng ating chest pain po natin or the heart attack.
It's horrible.
Well, the game is one thing, but you
No! 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 Ah! I can't believe it! Not again! That stupid ref! What is wrong with him? Oh, I'm gonna lose so much money on this game. Oh, this is just unbelievable. Can't believe it.
Hey, Joan, what's going on, man?
Oh, I'm watching this game and this ref. He doesn't know what he's doing. Oh, this is horrible.
Well, the game is one thing, but you don't look like you're doing so well. What's going on?
Oh, I don't know. I think I'm just stressed out. I've got a lot of pain right up here in my chest. It's almost like someone's sitting on my chest.
Well, I tell you what, that's pretty classic signs and symptoms, along with you sweating so bad, of a possible heart attack. Have you ever had a history of a heart attack or heart problems before?
No, I've never had any problems like that before.
Well, I'll tell you what, to be on the safe side, why don't we just call an ambulance and have them check you out?
No,
Just to
no.
make sure that it's not a heart attack.
No, I don't need an ambulance. If I gotta go to the hospital, I'm just gonna drive if I have to.
Well, listen, here's the deal. If it is possibly a heart attack, it is going to be so important for you to be seen and get whatever it is that's causing it removed so that you don't have more serious problems. And you would never want to drive yourself to the hospital, because if you go unconscious while you're driving that vehicle, you not only run the risk of hurting yourself or killing yourself, but could you imagine running into another car that's filled with children and family members and wiping them out? I mean, that's just too much.
No, I understand.
So I tell you what, why don't we just call 911? Let's get them on the way. If it's nothing, they'll be able to let us know that. But if it is something serious, then we're going to be able to get you in for treatment.
All right.
Let's give them a call, all right? Yeah, 911. Listen, you know what? There's a lot of research that shows that heart attack patients, if they can take aspirin, has your doctor ever said anything about not taking aspirin or that you cannot take aspirin?
Nope, I've never had a problem with it before.
Any allergies to medications that you know of?
No,
Any bleeding problems that would stop you from being able to take aspirin?
nope, nothing like that.
Okay, well, here's a couple baby aspirin. You can take between 2 and 4 of those. Just pop them in, chew it up, and swallow it. And that's going to help reduce the risk of further blood clot formation. It's not guaranteed, but it has been shown to be very helpful. So just swallow that down and just get into a nice position of comfort. If anything's tight or constricting, feel free to loosen that up and just kind of try to relax, okay, buddy? So let's take a closer look at heart attacks. First of all, what are they and why do they happen? Secondly, is there anything we can control or are we out of control when it comes to heart attacks? Thirdly, let's review the signs and symptoms so that we know that they may be having a heart attack and that it's important to call 911 or activate emergency medical services. Well, first of all, what's a heart attack? Well, a heart attack is anything that actually occludes a vessel that feeds the heart. And when that heart muscle begins to starve of oxygen, it causes pain. And that pain is usually what they feel when they say, yeah, it felt like an elephant was sitting on my chest, or it's this squeezing feeling. And sometimes it may even radiate to one or both arms. It can also potentially radiate up into the neck. And in some cases, they've even said it feels like jaw pain or a toothache. In women, it's very characteristic for it to actually go to the back, and it makes them feel like they might have pulled a muscle or have muscle strain. And in many cases, they might put it off because it's not that classic drenched in sweat diaphoresis being the technical term for heavy sweating. They might just feel like they're achy or that they've got indigestion. And so they can sometimes put it off for too long and then suffer other consequences as a result. But in the case where it's classic signs and symptoms, the heavy sweating, this crushing chest pain, radiating to one or both arms, up into the neck or jaw, shortness of breath, difficulty breathing, weakness, nausea, these are all classic signs and symptoms of a heart attack. Now, that isn't to say that other things can sometimes mimic that. They could be that they have angina that comes and goes, and so it feels like that for a little bit, but then it goes away. It's still kind of like thunder on the horizon, and they should take note of that and maybe rule out the chance that it is an active heart attack. But it can also be things like pneumonia or pleuritis or even a broken rib. But in the end, it's better to rule out the heart attack and make sure it's not something that's life-threatening. So if in doubt, call 911 and make sure that it's not a heart attack. So what are some of the risk factors? What do we eat? How much do we exercise? Are we smoking cigarettes or other things that are bad for us? If we have diabetes and we can control it, are we controlling it? Or is it out of control? Those would be classified as the controllable risk factors. Uncontrollable is more things like genetic predisposition, like I have this incredibly high cholesterol level and I'm a vegetarian. Well, that can happen. Things like diabetes that just won't stay in control no matter how much we treat it. Things like race, things like being male. So these are all the things that we have by research found to predispose certain people to cardiovascular disease, and there's not much they can do to change that. Not to say that there isn't other things they can do to help prevent heart disease. Now let's talk about the signs and symptoms. When they have those signs and symptoms like profuse sweating, chest pain, arm pain, neck pain, jaw pain, dizziness, shortness of breath, nausea, weakness, these are all classic signs and symptoms that the person might be having a heart attack. And if they display those signs and symptoms, our job is pretty clear. Call 911 immediately. Get the ambulance on the way. If it's not a heart attack, it's okay. We can always disregard the ambulance, or they can rule that out then. But if it is a heart attack, time is of the essence, and we don't want to slow any of that treatment down. Their life could depend on it. Remember that most people will want to deny that it's really a heart attack. They'll also probably want to drive themselves into the hospital. Both are extremely dangerous, not only for themselves, but for anybody who becomes a victim of a person who's unconscious behind a wheel, careening into that vehicle and hurting other people. So remember, if you're waiting for the ambulance and they can take aspirin, it's one of the first treatments that even the paramedics would do. Because aspirin, when it's absorbed into the bloodstream, works like a platelet lubricant. It actually helps blood platelets slide by each other so that they don't stick and make a bigger clot. So it's actually one thing that you can do if the patient allows you to give it to them, where they can take aspirin and help themselves prevent a worse heart attack or actually relieve some of the symptoms. If they have, say, nitroglycerin tabs or a spray and they can't get up to get it, you can assist them by going to get it and giving it to them. Remember to keep the patient as calm as possible. You can't lie to them and tell them everything's going to be okay because we don't know if that's true. But we could reassure them that they're going to be in good hands and that you're not going to leave them alone. If they have tight garments, we can loosen those up and then allow the patient to be in the best position of comfort they can find while we wait for EMS to arrive.
It was emphasized there na we need to take aspirin po. Usually kasi ang dose niyan will be 160 to 325 po. Para hindi talaga siya mag-lead na to stroke. Kaya nakakatakot din po yan. Alright, let's proceed na sa ating next topic. Ayan guys, ano kaya ang topic na to? Anyone from the group? Ayan, sige nga, try to analyze the situation. Ano kaya ang nangyari sa kanya? Letter A, nanalo ba siya ng loto? Or letter B, na-scam po ba siya ng 1 million? Or letter C, nag-iinarte lang po ba siya? Guys, ano kaya ang next topic natin? It's the syncope or the fainting. Okay po? Now, nangyayari po kasi ang tinatawag na fainting po natin or the syncope, lalo na pag may prolonged standing po tayo. 'Di ba? Aside sa prolonged standing na hindi ka gumagalaw, no, pwede rin po yung a sudden standing din, bigla kang tumayo, no? So biglang nagkaroon ng orthostatic hypotension si patient, or pwede rin yung extreme na emotion. 'Di ba? Like yung sobrang galit na galit ka lang na biglang yung basta yung parang na-shock ka bigla. Ayan, so that leads to fainting or your syncope. Now, ano ba ang gagawin natin? Ano ba ang management natin, sir? Huwag niyo pong papaypayan. Actually, meron po tayong maintain na 12 inches height. So you elevate the legs po for about 12 inches dapat yan. No? Ayan, or 'di ba? Tama ba ako? 1 foot, tama ba? 12 inches, no? 1 foot. So meaning basta i-elevate mo lang. Pero kasi yung mga yung mga marites, 'di ba? Wala namang walang mga ginagawa, walang mga naitutulong, yung mga pay, wala po. Kaya po siya nahimatay kasi pwedeng lahat ng mga dugo, no, ay nasa lower leg po ng patient po natin. Kaya ang gagawin po natin, you need to bring back lahat ng mga dugo na nasa legs, ibalik mo po sa central area ng patient natin. That's why you need to elevate. Ito kasi ayan, medyo tao ang ginamit na pang-elevate. Pwede naman kasing upuan, no? Pwedeng box, 'di ba? Pwedeng box, pwedeng upuan. Ito kasi parang siguro malamang sa malamang first aider talaga 'to. Kasi siya mismo, no, ang nag-lift for about 12 inches. 'Di ba? In-elevate niya para bumalik po, no, towards the central area or central part ng body. Tas papunta sa heart mo, tas ipapump niya naman towards systemic circulation. And that's for fainting. Next guys, ano kaya ang next topic natin? Anyone from the group?
Diabetes.
Ayan, diabetes po. Now, in diabetes kasi, hyperglycemia is a concern, tama? And of course, aside from hyperglycemia, mas delikado din talaga ang hypoglycemia. Kasi 'di ba pwede tayong napasobra sa insulin, pwede kang napasobra sa mga ohas mo, or sobrang diet ka lang din talaga. Kaya delikado po. Now, ano ba ang gagawin po natin, sir, in cases like hypoglycemia? Ayan, so let's have a clear animation muna. Kung ano ba talaga ang ibig sabihin ng diabetes may
New
be
Vicks Immune Defense. May vitamin C, high strength, vitamin D at zinc for 3-in-1 Immune Defense.
Sugar in the blood can cause serious, sometimes life-threatening health problems. There are two types of chronic diabetic conditions: type 1 diabetes and type 2 diabetes. Pregnant women may acquire a transient form of the disease called gestational diabetes, which usually resolves after the birth of the baby. Prediabetes is when the blood sugar level is at the borderline, higher than normal, but lower than in diabetics. Prediabetes may or may not progress to diabetes. During food digestion, carbohydrates, or carbs, break down into glucose, which is carried by the bloodstream to various organs of the body. Insulin is a hormone produced by beta cells of the pancreas and is necessary for glucose intake by target cells. In healthy people, beta cells of the pancreas produce insulin. Insulin binds to its receptors on target cells and induce glucose intake. In type 1 diabetes, beta cells of the pancreas are destroyed by the immune system by mistake. The reason why this happens is unclear, but genetic factors are believed to play a major role. Insulin production is reduced. Less insulin binds to its receptor on target cells. Less glucose is taken into the cells. More glucose stays in the blood. Type 1 is characterized by early onset. Symptoms commonly start suddenly and before the age of 20. Type 1 diabetes is normally managed with insulin injection. Type 1 diabetics are therefore insulin dependent. In type 2 diabetes, the pancreas produces enough insulin, but something goes wrong either with receptor binding or insulin signaling inside the target cells. The cells are not responsive to insulin and therefore cannot import glucose. Glucose stays in the blood. In other words, type 2 diabetics are insulin resistant. Here again, genetic factors predispose susceptibility to the disease, but it is believed that lifestyle plays a very important role in type 2. Typically, obesity, inactive lifestyle, and unhealthy diet are associated with higher risk of type 2 diabetes. Type 2 is characterized by adult onset. Symptoms usually appear gradually and start after the age of 30. Type 2 diabetes accounts for about 80 to 90% of all diabetics. Management focuses on weight loss and includes a low-carb diet.
Guys, question lang. What's the normal ulit? No? What's the normal glucose level? It's what? 70 to 110 milligram okay, per DL po. Tama po ba? Others kasi they're still following the ano. Ano ba yung mga fina-follow ng iba? Anyone? Kasi ito na yung pinaka-latest, di ba? The 70 to 110 okay, milligram per DL. So usually, masasabi po natin na you are hypogly na if less than 70. Pag greater than 110 naman, considered as okay, hypergly naman. Ako honestly, I'm a diabetic person eh. Malalaman ko yan kasi may rhyme tayo, di ba? Ano yung rhyme natin, sir? Cold and clammy, need some candy. Warm and dry, your sugar is high. So you need to take your anti-diabetic na po. So ulitin ko. Cold and clammy, no? Tas may mga shakiness ka pa. Ayan, you need some candy kasi you are hypoglycemia. But if you feel na masyadong okay, mainit ang katawan mo, tapos may blurring of vision na po, then your sugar is high. So pag sugar is high, depende yan. If you are type 1, then you need to have your insulin. Pero if you are type 2, then you need to have your OHAs or oral hypoglycemic agents. Ano bang mas safe? Insulin or OHAs? Anyone from the group? Anong mas safe po? Insulin or OHAs? Ayan, they consider insulin po na mas safe siya compared sa mga OHAs po natin. Kasi nga 'di ba, if you are pregnant then insulin is actually safe. Wanna know why? Because insulin won't cross placental barrier. Meaning it won't cause teratogenic effects sa mga bata. That's why 'di ba, through pregnancy, as the pregnancy progresses, you need to increase the insulin. Kasi lalo na on the let's say yung mga second trimester. On the second trimester kasi 'di ba, tumataas yung hormone known as the HPL or the human placental lactogen, which causes more and more insulin resistance. So more and more sugar po si patient. So again, mas safe talaga ang insulin. Kaya ngayon, yeah, I'm having insulin right now, the 70 30 po. Yun yung tinitake ko. Okay, next po. May idea ka ba dito, guys? Kung ano kaya ang nangyayari kay patient? Kapangyarihan ba yan? Or wala nang pambayad sa Shopee or sa Lazada? Ano kaya ang nangyari sa kanya? Anyone from the group?
Seizure.
Ha? Ayan, baka nag-seizure si patient. Pwede din. Kasi mga electrical conductivity po. Ayan, our next topic, ma'am, will be the stroke. And although, yes, may point din si ma'am. So parang ito, ma'am, ay blood clot po ito, causing stroke to our patient. Now, time is critical, ika nga. Why? Ibibigay ko lang din yung fun fact regarding the brain. Alam niyo ba ang brain po natin, pwede po siyang mabuhay kahit wala siyang oxygen for about 10 minutes? Yes, for 10 minutes. Pero pag lagpas na po 10 minutes, tas wala pa ring oxygen, guys, then that leads to irreversible brain damage. So, mas delikado. Although, fun fact talaga yon na pwedeng, for a span of 10 minutes, kahit walang oxygen, mabubuhay pa siya. Pero pag 10 minutes and above na po, irreversible, brain damage na siya. So, let's have the video. Ayan, regarding, stroke.
In this lecture, we're going to talk about stroke, and this will be our introduction to stroke. This is a really important lecture and a critically important topic. We see this a lot clinically and need to evaluate this in clinical vignettes. Let's start with, what is a stroke? Stroke is a disease that affects the arteries leading to and within the brain. Strokes occur when blood vessels that carry oxygen and nutrients to the brain are either blocked by a blood clot in the setting of ischemic stroke or become leaky and burst or rupture in the situation of a hemorrhagic stroke. Strokes are really important to understand. We're going to walk through the pathophysiology, the clinical presentations, the evaluation, and workup for patients who present with stroke. When we think about the causes or types of strokes, there are two types of stroke. The first is ischemic stroke, and this develops as a result of a blood clot. There is reduced perfusion, neurologic function. Patients present with that loss of neurologic function, and our evaluation with imaging and other studies are to find this area of ischemic or infarcted tissue and intervene as soon as possible. Once the tissue has died and the cells have been lost, function cannot be recovered, and during the recovery process, we look to recruit other areas of brain to fill in that lost function. And that's ischemic stroke. The second type of stroke is a hemorrhagic stroke. This is the leaky blood vessel stroke, where bursting or rupturing of a blood vessel results in leaking of blood into the brain, and you can see that here in this schematic. The buildup of blood results in inflammation. There's an inflammatory response that increases the total amount of water and cells that are in the brain. That can compress the nerves and blood vessels and result in secondary ischemia as well as loss of nerve function and cell function, and ultimately cell death, and that same loss of neurologic function. With hemorrhagic strokes, we see a greater likelihood of recovery because the ischemia that occurs is a secondary process, but we can still see substantial neurologic deficits. Our goal when evaluating either an ischemic or hemorrhagic stroke is to make the diagnosis as soon as possible and to intervene appropriately depending on the type of stroke that the patient is suffering. In general, we see that ischemic strokes are much more common. About 85% of patients who are presenting with a stroke will be suffering an ischemic stroke, a clot in some artery going to the brain, the cerebrovascular system. An important minority of strokes, about 15% of strokes, will be the hemorrhagic strokes, where weakening of the blood vessel results in rupture of the blood vessel, bleeding in and around the brain, and neurologic dysfunction for that reason. We're going to spend a lot of time talking about each type of stroke. When patients present, odds are we're worried about an ischemic stroke, but we need to be mindful of those patients presenting with a hemorrhagic lesion. And this is a good opportunity to talk about terminology. When we talk about hemorrhages in the brain, there are both intracranial hemorrhages, and that's bleeding anywhere inside the calvarium, the skull, and then there's intracerebral hemorrhage. When we think about the types of hemorrhages that we can see in the nervous system, there's intracerebral or intraparenchymal hemorrhage, that's hemorrhage inside the brain tissue, and subarachnoid hemorrhage. Those are both strokes or types of hemorrhagic stroke. We can also see bleeding outside of the brain but inside the calvarial vault, and that includes subdural hemorrhage, epidural hemorrhage, and other types of hemorrhage. Those are not considered strokes, but are important types of intracranial hemorrhage. Some important terminology as we embark on learning about stroke.
Okay, for our next topic, may idea ka ba dito, guys? May idea ba kayo? So we have the tonic phase, which is actually derived from the word tonicity, nasa paninigas ng patient. The clonus kasi is the jerky movement. So therefore, what's our next topic? Anyone from the group?
Seizure.
Ayan, yun na po yung sabi ni Ma'am Hanan Obilio kanina, that's the seizure. Everybody say seizure.
Seizure.
Ayan, with your seizure kasi, ayan, grabe yung mga impulses, no? Yung mga brain activities po natin, hindi na siya ma-control. So that leads to the tonic, okay, and clonic, okay, phase ng patient natin, known as the generalized seizure. Now, with your seizure, guys, this is a sudden uncontrolled electrical disturbance in the brain. Tama po? Ayan, in which safety talaga is very important here. Ayan, wait lang. With seizure po, what's the first letter for seizure? So we have our letter S. Ayan, my first letter S will be the word safety. This is always our priority dapat, guys. Kasi mag-jerky movement si patient, maninigas ang patient mo, kaya dapat alisin dapat yung mga, let's say, appliances na kailangang tanggalin po yan. Aside from the safety po, kailangan din ang tinatawag na, okay, isa-slide ang patient natin or slide muna natin. So we have the next letter S po, and that's the slide. Isa-slide po natin yung patient sa floor, pero protecting pa rin the head of the patient. Huwag mo namang itulak sa floor. Ipapaslide lang po natin siya sa mas, okay, mas safe na area. Floor is actually a safe one. Safe area po siya. Ayan. Now, aside from sliding, okay, the patient, to promote comfort, diba? And to promote safety din. Ayan, dapat nag-side lying din dapat si patient. So, guys, pa-mute na lang ha. Oh my God. Pa-mute na lang po. Kasi minumute ko na pero ina-unmute pa rin. Sorry po. We have the side lying. Next, we have the suctioning. Ma'am Jessica Nieto, pa-mute na lang, ma'am. So we have the suctioning also. Ayan, so we need to suction yung mga drainage po natin. Na-unmute po siya for a while. So again pag may seizure si patient, safety is important. You slide the patient to the floor. I-slide po natin siya sa floor. Ayan, protecting the head pa rin of the patient. And then you turn the patient to side, na lalo na pag may mga secretions. Or if ayaw nyong i-turn to sides ang patient po natin, pwede naman pong i-suction. Mga suction machine. Guys, pag nasa loob po ng tinatawag na patient's room, if ever lang, naalala nyo ba, bawal na po ang mga padded tongue depressors po natin. Wait lang, parang sira ata itong Sorry. Parang sira ata ang ni Ma'am Nieto. Nilagay ko muna siya sa waiting room. Medyo na-distract kasi ako. Hindi, unmute kasi. Wait lang. Ayun na, pumasok na po si Ma'am Nieto. Hello, Ma'am Nieto. Okay lang po ba yung gadget mo, ma'am? Parang nasira ata yung gadget mo kasi mute, unmute. Ayun. Okay na po si Ma'am Nieto. Hey, Ma'am Nieto. Ayan, bumalik na naman siya. So we have here the safety, slide the patient to the floor, we have the sideline, then we have the suctioning of the patient. And that's for your seizure. May prepare naman ako na video, guys, na ganun talaga pag first aid, na more of videos po tayo. Wait lang nasa na ba yung video ko dito? About, seizure. Ayun, seizure, first aid. For a while lang po. Oh, may na naman to. May advertisement na naman to. For sure si Lenny to. Just.
A seizure, also known as convulsion or fit, can be caused by a disruption to the electrical activity in the brain, which may lead to uncontrollable contractions in muscles and unresponsiveness. If a seizure occurs, the most common cause is epilepsy, but it can be caused by other things, such as alcohol poisoning, a lack of oxygen, after a head injury, after taking certain drugs, or if someone with diabetes is having a hypo where the blood glucose is too low. When someone is having a seizure, you may find they have sudden loss of responsiveness, rigid body with arching back, noisy and difficult breathing, convulsive, jerky, uncontrolled movements, saliva at the mouth which could be blood-stained if they've bitten their tongue or cheek, possible loss of bladder or bowel control. Afterwards, they may be confused, tired, and fall into a deep sleep. If you suspect someone is having a seizure, it's important to protect them from harming themselves during the fit. Clear away any potential dangerous objects like hot drinks or sharp objects. Don't restrain or move them. Make a note of the time when the seizure started and how long it lasts. Protect their head by placing something soft underneath or around it, like a towel, and loosen any clothing around their neck. Once the seizure has stopped, open their airway and check their breathing. If they're breathing, put them into the recovery position. If they stop breathing, more than 5 minutes, they are unresponsive for more than 10 minutes, or they've sustained an injury. So remember, protect, but don't restrain them. Call 999 or 112. And that's how you help someone who's having a seizure. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
Okay, so we're done na with your seizure. Okay, next po, we have the topic shock. So guys, na shock is actually a life, okay, threatening situation. However, kasi na yung topic po natin na this afternoon will be more of the okay hypovolemic shock po or ang pagbaba, no, or let's say excessive loss po tayo ng tinatawag na fluids po sa katawan po natin. For a while lang ha. Ayan. Meron po tayo okay video. Ayan, regarding okay shock.
Shock is a serious life-threatening condition that happens when vital organs in the body are not getting enough blood flow, and this can lead to failure of these organs and the heart. Shock can be caused by anything that reduces the circulation or blood flow, such as severe bleeding, which you may be able to see or it may be hidden and internal. If the heart is unable to pump blood around the body after problems like a heart attack, severe heart disease or heart failure. Loss of bodily fluid following severe vomiting, diarrhea or severe burns. After a severe allergic reaction or severe infection, and following a spinal cord injury. These conditions may all lead to life-threatening shock. When someone is in shock, they may have a fast pulse, pale, cold or clammy skin, sweating, fast, shallow breathing, grey-blue skin, especially inside the lips, weakness and dizziness, nausea and possible vomiting, thirst. As the shock becomes more severe, they may have a weak pulse that you may not be able to feel, restless and aggressive behaviour, gasping for air, they may become unresponsive. To treat for shock, you need to try to reverse the cause of shock. If you find severe bleeding or serious burns, try to treat these whilst reassuring the casualty. Help the casualty to lie down. If possible, try to lie them down on a rug or blanket, as this will help protect them from the cold. Raise and support their legs above the level of their heart, as this will increase blood flow to the head and vital organs. But if the casualty has an injured leg, do not raise it. If the casualty is pregnant, help them to lie with their body leaning towards their left side to prevent obstruction of blood flow returning to the heart. If you haven't done so already, call 999 or 112 and tell ambulance control that you suspect shock. Once you have called for emergency help, you can then loosen any tight clothing around their neck, chest and waist. Stay with the casualty and keep them warm by covering them with the blanket or coats. Try to reassure them and keep them calm. Keep monitoring their level of response. If they become unresponsive, open the airway, check their breathing and shock. Treat the cause of shock. Lay them down and raise their legs. Loosen any tight clothing and keep them warm and calm. Monitor their level of response. And
Sa
that's how
UK
you treat
po, it's 999 or 112
shock.
no ang kanilang ano guys, ang kanilang emergency hotline.
This
But
video
pag sa
has been
US na
helpful to you.
so guys, if ever po kung may mga bleedings po tayo, diba, the usual kasi na management natin will be the mnemonic price. Ayan, ito ang pinaka-common talaga na mnemonic every time na may bleeding tayo. Anyone from the group, your letter P stands for what? The pressure. Great. Now you put pressure dapat. Letter R stands for what? Rest. Tama po? Kailangan ipa-rest natin. Kasi the more nagagalaw ang patient, the more pong magbi-bleed ang patient natin. Next, letter I. Immobilize. Ayan, kailangan immobilize po natin. Next, letter C stands for what? Cold. Compress. Hindi kasi pwedeng mag-warm compress. The more kasing magbi-bleed ang patient natin. So dapat, okay, cold compress lang. 'Di ba? I-ice natin. Na ice compress, 'di ba? Gamit ka lang ng ice. Next, we have a letter E. You need to elevate. Okay, the affected area to prevent okay, bleeding. So again, the mnemonic price, na. So we have your the pressure, okay, rest, immobilize, cold compress, and then we have the elevate po. Now, if you're ready, let's have the video po of your bleeding na. Mhm. Wait lang ha, saan yung bleeding ko dito? Bleeding first aid. Ay, bleeding love pala to. Wait lang guys. So we have the bleeding first aid. Ayun.
When bleeding is severe, it can be traumatic and distressing. If someone's bleeding isn't controlled quickly, they may develop a life-threatening condition called shock, and they may become unresponsive. Bleeding from the mouth or nose may affect the breathing, so try to ensure that the airway is kept clear. Obstructed airway can be a cause for a casualty to become unresponsive. If the casualty becomes unresponsive at any point, open the airway and check their breathing and prepare to treat an unresponsive casualty. To treat someone with a severe bleed, put gloves on if you have them, as this will help to protect you both from infection. If the wound is covered by clothing, remove or cut the clothes to uncover the wound. Is there an object in the wound? If there is, don't pull it out because it may be acting as a plug to reduce the bleeding. Instead, leave it in and apply pressure on either side of it to push the edges together. If there is no object in the wound, apply direct pressure on the wound with your fingers and use a sterile dressing or clean, non-fluffy pad to stop the bleeding. If you don't have a dressing, ask the casualty to apply direct pressure themselves to stop the bleeding. Jenny, can you apply some pressure for me, please? Brilliant, excellent, well done. Ask a helper to call 999 or 112 for emergency help. Or if you're on your own, use a mobile on speakerphone so you can keep treating the casualty. Tell the emergency services where the bleeding is coming from and the amount of bleeding. The casualty may develop shock, so help them to lie down on a blanket or rug if there's one to protect them from the cold. Raise and support their legs so they are above the level of their heart. Do not raise the leg if it is injured. Jenny, could I lay you down? Excellent. Just going to lift your legs up. Is that okay? Secure the dressing with a bandage that is firm enough to maintain the pressure but doesn't cut off the circulation. So I'm just going to apply this dressing to the bleed. Okay. Want to take your hand away? Well done. Okay. Can you hold that for me? Excellent. Okay, can I have this? Okay. Check the circulation by pressing a nail bed or skin beyond the bandage for 5 seconds. Release the pressure. And if the color does not return within 2 seconds, the bandage is too tight. If blood shows through the dressing, don't remove it. Just apply a second bandage on top. Okay, can I have this? Okay. If blood shows through both dressings, remove them and apply a fresh bandage, ensuring there is direct pressure applied at the point of bleeding. Support the injured part with a sling or bandage, but check circulation every 10 minutes. Keep monitoring the casualty's level of response while waiting for help to arrive. So remember, when treating severe bleeding, wear gloves if available. Remove or cut away any clothing from around the wound. Check for objects in the wound, but don't remove them. Apply pressure on either side of the wound. If there's no object in the wound, use a dressing or pad and apply direct pressure to the wound. Call 999 or 112 for emergency help. Secure the dressing with a bandage. Treat the casualty for shock. Support the injured area. Keep checking their level of response while waiting for help. And that's how we treat someone with a severe bleed. If this video has been helpful to you, help support St. John Ambulance by going to SG
from the circulatory system. So we have the two types. The bleeding you can see, which is actually obvious, no, like may mga head trauma, no, like may mga exits ng tinatawag na blood, like let's say, what if gunshot wound pala ang patient po natin, or may gunshot wound or GSW, so obviously. Pero what if pala may mga blunt trauma si patient, no, such as yung may mga hematoma, so medyo ito yung mga bleeding na you can't see kasi walang mga exits po ng tinatawag na blood no, sa kanilang katawan. It's more of the inside. So again, mas delikado po ang bleeding, okay, you can see. Now, my next topic will be more of burns na po tayo. Sige, so we have the burns in children, and then we have the burns, okay, in adult patients po. Saan na ba yan?
Oh, I hope these cookies are done. Ow!
Now let's talk about burns. Generally speaking, there are 3 different degrees most prevalent: first, second, and third degree burns. Third degree being the most severe and life-threatening. First degree burns are characterized by a superficial burn that's normally red and painful. The second degree burn then develops into a blister, while the third degree burn is a full thickness burn, sometimes noted even with charring all the way down to the bone. The way we treat the burns are exactly the same. Remove them from the source of the burn, A. B. Cool the burn with water. And C. Cover the burn with dry, sterile dressing whenever possible and get the patient or the victim to the hospital. The bigger the burn, obviously, the more the complication. This is a fairly large size burn, and we can see blisters, some popped and some not popped. The way we treat a second degree burn in this case is by actually cooling the burn, which we're going to show in just a moment. The third degree burn will be the same exact way, but we need to really expedite getting this person to the hospital. If they had a burning agent that caused that severe of a burn, we have to be thinking about what else might be going on. Was it involved in a house fire? Did they get scared and inhale an enormous amount of heat? The singeing of the nose, the mouth, there's soot on the tongue, means that they could have possibly inhaled that heat blast, and now we're going to be dealing with some swelling of the airways in a short amount of time. So will they actually be in respiratory distress within the next few minutes? These are all considerations we need to think about as we're looking at the overall management of a burn patient. We also need to be thinking about the fact that the larger the burn, in fact, when it starts to cover percentages of the body, this person is losing a lot of fluid, and they're also losing their heating and cooling system. So the fact that we've already cooled them down with water, and the fact that they are already wet, probably if we had to put their clothing out with water, means that they're also going to be running into hypothermic events. And that's something we need to be mindful of the whole time while we're treating the patient, as well as looking for signs of shock: pale, cool, sweaty, and they might be losing consciousness. Now let's cover the treatment of this specific burn, which is first and second degree. As we said before, we want to make sure that we check the patient for any life-threatening complications, breathing problems, decreased level of consciousness. If that happens, we're going to call 911 right away. In this case, she's fine. She touched her hand to a hot item, and so it's isolated just to the top of her hand, first and second degree. Big blisters, but not super duper big blisters, not the full arm. So though she's going to have some things to think about here, it's not something that I'm going to be thinking life-threatening. In fact, in most cases, even severe burns, as long as they weren't affected through respiratory, they're not life-threatening in the first 6, 8, 10, 12 hours of the actual injury. It's all the later complications that start to occur, like hypothermia, loss of fluids, and so on. So in this case, we're dealing with pain management, really. The cold water is going to help anesthetize the skin. It's going to help bring some soothing to that area. But as soon as we take it out from the water, it's going to start to hurt again. So we need to expedite getting this person to the med center, or even better yet, probably to the emergency room where they might have a burn center available to treat it appropriately, to reduce the chances of infection, and to help the patient with pain management. I'm going to cool this underwater regardless of the degree of the burn until the tissues are fully cooled and the burning has stopped. Now, contrary to what might have been taught in the past, we're really simplifying this down to one treatment. Cover after we've cooled it with a dry, sterile dressing whenever possible, and transport the patient to definitive care. I'm still going to be watching this patient for signs of decreased level of consciousness, signs of shock, and signs of complications with their breathing. But for the most part, this is what we're talking about. And keeping this clean, keeping it minimally agitated, not popping the blisters, and getting them to definitive care is the idea when it comes to burns.
Hi, pa-on po ng mga cameras po nila. Check ulit natin yung mga participants po natin. So ganun talaga ang pacing po ng ng ating first aid, na it's more of video. Ayan. Sige, check muna natin ang ating participants kasi about to end na po tayo ng ating 2-day seminar. Ayan. Sige, pa-on na lang po. For a while lang ha. Ayan, let's have the question and answer portion muna tayo. Huwag kasi kayong mahiya, pwede naman mag-ask ng questions. Parang wala pang nag-ask ng questions since kahapon. Hindi naman ako ma-offend eh. Pwede naman magtanong talaga ng questions. Basta related lang sa topic ha. Huwag mo naman akong tanungin kung sino yung ex ko dyan sa Legazpi. Basta doktor yon sa BRT. Basta consultant yun eh. Naka-move on na po ako. Questions? Questions? Pwede naman mag-type. Pwede mag-direct message naman po. Wala? Kasi magpo-proceed na po ako sa sa next ko na at saka sa last topic ko na po. If wala na, proceed na ba ako sa ating last topic para matapos na tayo at makapag-bonding na kayo sa family nyo kasi it's Sunday eh. Syempre family day ang Sunday. 'Di ba? Tama ba ako, Ma'am Mary Joy Buban? Parang feeling ko parang feeling ko to lang video okay yung family niya sa labas. Tapos nandyan lang siya sa loob, no? Parang KJ. Party na sila, tas tayo, 'di ba? Paano tayo eh? Pabida-bida tayo eh, 'di ba? Kunwari, nagsi-seminar. So I'll proceed na sa aking last topic, guys. I hope na may mga learnings po tayo, hindi lamang today but rather kahit kahapon din with our BLS. Basta careful lang po kayo na in performing BLS ngayon kasi hindi po natin kilala at hindi po natin nakikita ang ating tunay na kalaban. Alam nyo ba, may bago na naman ngayon na na-discover. It's a combination, 'di ba, of your Delta and Omicron. Ang term nga nila, 'di ba, sa sa Cyprus eh. Sa Cyprus siya na-discover, Deltacron. Kinombine na nila si Omicron at saka si Delta. Kaya ang term nila is Deltacron. Kasi parang na-mention yan ng DOH eh. Parang kaninang morning. Deltacron. Grabe, hindi pa nga nakapenetrate si Iho. May Iho kasi tayo. Iba naman yung Iho na shark. Pag Bisaya kasi Iho eh, no? Ihu, IHU. Sa France naman yan. Yung Delta Cron na naman, no, Diyos ko, mas matapang na naman daw. Diyos ko, nakaka-stress naman to. Sige, so I'll proceed na po. We Pump Admin, I'm down to my last topic na po. Thank you guys for choosing We Pump. No, since for 2 days talaga tayo nagsama-sama. Kahit yung iba ay hindi talaga mag-on ng camera. Patigasan na talaga to, no? Pag-on na Wait lang ha. Okay lang ba maganda tayo? Mag-group pic tayo. Wait lang. Screenshot ako ha. Mag-group pic tayo guys kasi itatag kayo ng WePump. Tapos para sabihin ng mga friends nyo, ay nag-attend siya ng seminar, ay matalino to. Kasi nag-update siya ng Sige, so i-play ko na ang ating last topic which is the electrocution. This is really common, lalo na pag medyo syunga-syunga at biglang nakuryente that can lead to shock, na electric shock, kay patient. Full volume na po tayo.
In this video, you'll learn to administer first aid to a person who's been electrocuted. Before touching the victim, always turn off the source of the current, either by pulling the plug out or by turning power off by a switch or circuit breaker. There are 3 possible scenarios to consider depending on the condition of the victim. Scenario 1. The victim is conscious. Check their skin for any signs of burns at the entry and exit points of the electrical current. Wet any burns under running water for at least 5 minutes or until the pain has subsided. Call the emergency services in all cases, as the electrical current may have caused internal injuries. Scenario 2. The victim has lost consciousness but is breathing normally. Put them in the recovery position. Alert the emergency services. Apply cold compresses to the burns until medical help arrives. Scenario 3. The victim has lost consciousness and is not breathing. Alert the emergency services. Start cardiopulmonary resuscitation.
Okay, tapos na po ako na with our basic first aid, guys. So again ayan, magpapakilala po kayo if ever kung may mga basic knowledge po tayo regarding first aid. No, I am Mark Adlawan. I am trained in first aid. So pwede ka nang tumulong. Pero make sure if ever kung tutulong ka, dapat may mga gamit ka din. Dapat may mga first aid kit ka. Kasi kunwari, pupunta ka doon tapos wala ka namang gamit, mababash ka lang. Anong gagawin mo, te? Wala lang, no? Support system, hindi ka first aider doon, no? Support system ka lang, okay? Sige, so WePump, okay na po ako. Thank you po, no, WePump. Ayan, so meron po ba tayong next training, WePump? Every Saturday, Sunday kasi ang aming trainings. And keep posted na lang po, no, for our next mga concepts, or let's say next na mga, baka may mga pa-seminar kami, guys, na thank you din so much, no, for choosing WePump. Nag-enjoy ako, guys, kasi nasabi ko talaga na very interactive talaga na tong grupong to. May mga moments kami na parang ako lang talaga yung nagsasalita. Feeling ko busy talaga sila. Pero ito kasi naramdaman ko na okay, may connection talaga tayo. By the way, guys, I'm a national reviewer, international reviewer also, no? With NLE and with NCLEX din. So if ever lang kung mag-NCLEX na kayo, pwede naman kayong mag-contact sa WePump, no? Or let's say for the NLE soon kasi this year na gagawa na po kami ng mga review series na po. Anyway, online naman kasi halos lahat eh. Yeah, thank you so much. Mag-ingat po kayo ha. Ingat po against COVID.
Thank you po, sir.
Thank you so much. Thank you so much. Ingat po. Ingat po.
Ingat, sir.
Yes, thank you.
Thank you po.
Thank you so much.
Yung mga nagdidrik ka na send na i-send nyo na lang po sa chat room. Thank you.
Thank you, WePump admin. Thank you. Thank you so much, Ma'am Joy. Ingat po.
Thank you po.